plastic surgeon. I will read the CV of Dr. Hosung Choi. Dr. Hosung Choi is graduate from Yonsei Medical College, Seoul, Korea. His work experience is at Piena Aesthetic Clinic, and he is the chief board member of Korean Aesthetic Surgery and Laser Society, and also chief board member of Korean Academy of Facelift and Contouring. His activities is involved in Global Key Doctor of Samyang Holdings Corporation, and also of 𝐂𝐨𝐧𝐭𝐤 and Mass Aesthetic, Sinclair Pharma, and Global Training Instructor of 𝐊-𝐿-Chem, Pharma Research Product, and 𝐊𝐿-𝐿. He will talk about the lower face and neck contouring through the K-lifting technique using molding and cutting PDO threads. Dr. Hosung Choi, good afternoon.
Hello.
Good evening.
Yeah.
I think should be around that time, yeah, in Korea. Yeah. How are you, doctor?
Yes. Yes, fine, good.
Okay.
It's really nice to meet you. Can you hear me clearly, guys?
Yeah, we can hear you.
Okay.
The stage is all yours now. Okay.
Okay. First, I will share my slides. Okay, let's start the lecture. Okay, first I would like to appreciate Samyang Company for inviting me to this wonderful conference, I-SWAM, as a speaker. Today I'm going to talk about lower face and neck contouring through K-lifting technique using molding and cutting PDO threads named Croquis. For the past 10 years, I've been participating as a consultant and training instructor of various fillers and threads. The most noticeable changes in the aging process of the lower face are the appearance of Marian lines and the sagging of jaws, resulting in distortion of the jawline. The causes of jaw sagging are the loss of skin elasticity and descent of the jaw fat, like this figure. As the neck ages, the elasticity of the neck skin decreases. That causes emergence of platysma bands and the ptosis of the submental fat, which widens the cervicomental angle. Although the horizontal necklines are not exactly a sign of aging, they can be accentuated by aging. The thickness of the neck skin is about 1.5 mm, which is quite thin. There is a thin subcutaneous fat layer or pre-platysmal fat layer underneath the dermis. Underneath the platysma, a subplatysmal fat layer, which is a deep fat layer, is located where most thick veins and nerves are running. So when inserting threads for the purpose of lifting the neck skin, the target layer should be the pre-platysmal fat layer. That means threads should be located above the platysma. If you go deeper, then you may damage not only vessels, but also the submandibular gland. When lifting the low face, we should also be aware of the precise location of the parotid gland. The parotid gland is the biggest major salivary gland, and the tail part is the most inferior portion of the superficial lobe. It is triangular shaped, located deep to the platysma muscle, below the mandibular border. so it may be damaged when lifting the low face or submental area using threads. If an inflammation of the gland occurs due to deeply inserted threads, it may cause a severe peritonitis, so more careful attention is required when performing these procedures. When choosing vectors for lower face and neck lifting, we have to determine the area to be lifted first. And to lift jaws more effectively, I would recommend to choose 3 vectors at the same time. To lift the submental area, the vectors should be parallel to the jawline, and the appropriate vector for neck lifting is superolateral direction. This pattern design is the most commonly used to lift low face and jawline. A total of 3 entry points are made, and 3 threads are inserted at each entry point. First entry point is made where the horizontal line from the brow tip meets the hairline. And the second one is made 1 centimeter in front of the tragus. And the third one just below the earlobe. This is a conventional and basic pattern design for neck lifting. However, inserting the threads from lateral upper neck downward to anterior lower neck has some clinical limitations. This is because the threads are prone to breakage due to frequent rotational movement of the neck. As a result, thread migration may also happen frequently after its breakage, and the thread can be touched or visible through the skin due to thin skin and curved surface of the neck, which is especially common in older patients. Therefore, I would recommend to perform a reverse insertion technique combining with jawline lifting and the submental lifting technique, making entry points at the midline, which is also a useful way to enhance the lifting result of the neck. This submental lifting technique is called a hammock technique. Entry points are made along the midline between the mandibular border and the hyoid bone, which is located at apex of the cervicomental angle. The first entry point should be made at least 1.5 cm below the lower border of the mandibular border. After inserting all the threads, tie the 2 threads at each entry point. This is a useful pattern design for lower face and neck lifting. I usually use 19G 100 millimeters long molding cork threads for vertical vectors and 19G 60 millimeters long cutting cork threads for horizontal vectors. And for occipital lifting, I prefer to use 20G 6 centimeters long cutting cork threads. When performing hammock technique, I mainly use 19G 60 mm long cutting cork threads. Since the HA filler play an important role for smooth contouring of the low face, it is generally recommended to combine HA filler injections when contouring the low face using threads. First, melomental folds or Marian lines and prejowl sulcus can be corrected to attenuate the prominence of the jowl. Second, chin projection may be considered to make the double chin look less pronounced. It's quite useful method. Botulinum toxin injection is also commonly used for jawline definition and neck skin tightening. In general, the target muscles are DAO and platysma, including platysmal bands. HIFU is also a useful treatment modality to correct neck skin laxity. I mostly use a 3 millimeters depth transducer for neck rejuvenation. I usually deliver 200 to between 200 to 300 lines. Now I'll show you a video about the lower face and neck lifting using various Croquis PDO threads. Before starting the procedure, I'm checking the target areas to be treated, which are jowls, jawline, and submentum area, and neck also. Accurate pattern design is as important as the process of inserting threads. So the design should be done in the patient's sitting position. For submetal lifting, I'm marking 4 entry points, and for neck lifting using occipital lifting technique, I marked 5 entry points. And for lifting the lower face, I'm marking 3 entry points. That means I'm using 3 vectors. And most of them are targeting the jowl. I'll use 9 threads per side using 3 entry points. Now I'm injecting lidocaine containing epinephrine on each entry point. After making skin puncture using 18G needle, I'm injecting tumescent fluid. There are 2 roles of tumescent fluid. One is to reduce pain through anesthesia containing lidocaine, and the other one is to create space for the thread to be inserted, making it easier to insert the thread without causing skin dimples. When inserting the needle, pinch the skin symmetrically to easily approach into the proper layer, which is a subcutaneous fat layer. And right after the cannula tip passes through the dermis, insert thread at almost parallel to the skin surface, which is almost 10 degrees or less. Since it's difficult to retrieve once a thread is inserted, it's important to locate the thread into the right depths from the beginning, and always use the other hand, non-dominant hand, for supporting the insertion and checking the depths of the cannula during the advancement of the cannula. Usually there may be some resistance in that area, which is subzygomatic arch due to very tight zygomatic cutaneous ligaments. So pinching the skin is quite useful method to maintain the constant depth. As I mentioned earlier, there's a parotid gland in front of the tragus. So when advancing the cannula in this area, you should be very careful. Should stay very superficial. That means immediate subdermal plane. Do not go deeper. Yes. We can. I'm checking the anchoring of the cogs. And if you see some dimples, then just gently press the dimple area while pulling the thread. Then usually it is easily resolved. When approaching horizontally from just beneath the earlobe, you can go advance the cannula up to the Marian line without crossing the Marian line. Just before the Marian line, you can put the thread, and this vectors is quite useful to effectively lift the jowl fat. Before cutting, remove any hair from the entry point to prevent infection. Pull the thread, use your finger to press down and cut the thread as closely to the skin as possible. And to release the tension at the entry point, pull the skin tissue around the entry point away from the thread direction, like this. Then, even though there may be some skin dimples at the entry point, which is easily resolved by pulling the skin. And during pulling the skin, check the whole pathway of the thread. Minor dimples, minor folds are not a big deal. It will be spontaneously resolved. But if there's a severe dimple or fold of the skin, it's better to release them before finishing the procedure. For this entry point, it's very easy to release the dimple by pulling the earlobe to lateral direction. Then I repositioned the jowl fat and I lifted the jawline together. The same procedure is repeated on the left. I'll play the video a little faster. See, I'm always checking the depth of the cannula by touching using my left hand, because it's very important to keep the constant layer during the whole passage of the thread. Now I'm performing the hammock technique for submental lifting. Since the submental area is a pain-sensitive part, tumescent solution infusion may be required. You can either inject lidocaine by using a sharp needle, but I would prefer to use tumescent fluid, but not too much volume, because if you infuse too much volume, there will be some swelling and the lifting effect may be reduced. I'm making a skin puncture using 18G needle, and the distance of between the two entry points is less than 1 centimeter, between 0.5 mm and 0.5 centimeter to 1 centimeter. And it's very important to approaching vertically to the skin puncture in the beginning. And after inserting the tip of the cannula, then you should be sure that the tip of the cannula is located deeper enough to the bottom of the subcutaneous fat layer, and then change the direction of the cannula parallel to the skin, and carefully advance. Go deeper vertically, and then change the angle horizontally, like this, because I will tie 2 threads at each entry point. So if you insert the cannula too superficially in the beginning, then after tying the knot, there may be some skin dimples at the entry points. And sometimes it's not easy to resolve these dimples. So initially, go vertically, and then like this, then go horizontally. Now I'm tying 2 threads. Do not tie too tightly. However, you should tie twice at least. 3 times, you can tie 3 times, but the knot will, the size of the knot will be too large, and the patient can touch the knot on the skin. I think twice is most appropriate. And then there will be some dimple because of the knot is still exposed. You can just pinch the skin symmetrically, and usually the knot go inside underneath the skin. So the dimple is usually easily resolved. That's why I prefer to use thin threads, not too thick, which is about USP 2.0. You may see some skin fold on the submental area, but it is easily resolved after cutting the thread, like this. Pinching the entry point, the skin around entry point, and if there's still remaining dimple, you can use the forceps to release the dimple. Minor folds or dimples on the passage of threads are not a big deal. Don't worry about them, because they are usually they last only a few days or only 1 or 2 days. Okay, the last part, I'm performing the occipital lifting technique. The skin in this area is relatively dense and tightly attached to the fascia. So it's quite sometimes difficult to advance cannula, blunt cannula. So you should be very gentle and very careful when inserting the threads or tumescent cannula for tumescent infusion. So this tumescent infusion is quite helpful to make cannula easily advanced. I'm making 5 entry points, and for this part, I insert only 1 thread per entry point. And you see, I'm advancing very slowly and gently, because patients may feel pain during insertion. However, this technique is quite useful because there's less affection of neck rotational movement. Even though patient move neck very frequently, it doesn't matter because it's holding the posterior neck tissue. So the effect will last quite longer. Before cutting the threads, pull the thread to the other side to make sure that the cogs anchor the skin tissue well. However, if you pull too hard, if you pull the thread too hard, it might come out of the skin, so pull it softly. And then pull the skin to the opposite direction, and then entry points, skin dimples will be resolved. Same procedure. Usually I infuse only 3 to 5 ml of tumescent because there's no enough space to infuse tumescent. And since I'm using very short PDO threads, okay, now I'm inserting about 20 to 30 monofilament PDO threads. These monofilament threads can be expected not only to have a tightening effect of the submental skin, but also to have a better anchoring effect of cogs previously inserted. I used a total 36 various types of Croquis and 10 monofilament threads. And 1 month after treatment, her jawline and her double chin looks improved noticeably. Even 3 months after treatment, the lifting result of her jaw and jawline is well maintained. Of course, she is another patient. Before wrapping up my, okay, this is another case. She, after 3 months, her jaw fat protrusion looks much improved, and her jawline is showing much more defined. Okay, before wrapping up my lecture today, let's briefly talk about the strong point of Croquis PDO threads. According to a recent study, 90% of physicians are unhappy with the quality of PDO thread used for the facial lifting. It's due to experiencing thread breakage in the process of storing the thread, or an early breakage of the thread after the procedure, resulting in rapid relapse. However, Croquis is the most fundamental and well-made PDO thread because Samyang company has been professionally researching and developing raw materials for PDO sutures since a long time ago, and 80% of all PDO threads on the global market are made from raw materials supplied by Samyang. Croquis bar holding strength is well managed by a high quality assurance system from Samyang company. As a result, Croquis has an outstanding durability. If properly stored, the quality of Croquis will be maintained for more than 3 years, not 6 months. This is my conclusion. Customized therapeutic approach is essential to achieve better and more natural outcomes always. And combined use of various types of highly qualified PDO threads, such as Croquis, can provide a better predictability and longevity. Okay, that's it, my lecture today. Thank you for watching and listening my presentation.
Okay, thank you, Dr. Hosung Choi, for your nice presentation. Do you have time for any question and answer? If there is question, if not, then it's okay.
Maybe just one question.
Okay.
Sorry.
Okay. Ada pertanyaan? Any question? Silakan bertanya dalam bahasa Indonesia. Saya akan terjemahin ke dalam bahasa Inggris. Ada? Okay, I think I'll ask you a question. Maybe what is the downtime for using this thread? Yeah?
If the procedure is properly performed, I mean, no severe hematoma or no severe bruising, then I think 2 to 3 days. After 2 to 3 days, patient will look normal without any unnatural feature. But patients may feel a little discomfort during opening their mouth or moving their neck up to 2 weeks. So appearance will be normalized within 2 to 3 days, but patient's feeling will be normalized after about 2 weeks.
Okay. Is it any different of recovery time between neck lifting and face lifting?
I think usually to contour the face, usually I use more threads, more number of threads than the neck lifting. So that's why I think the downtime is a little longer when I perform for the facial lifting. However, for the neck lifting, I only use for the submental area and the posterior neck area. So these areas are hidden areas when we look the patients in front. Then, so I think downtime is quite shorter for the neck lifting than the facial lifting.
Okay, thank you for your answer, Dr. Hosung Choi. I think there will be no more questions. Please give big applause to Dr. Hosung Choi. Thank you for your nice presentation, Dr. Hosung Choi.
Bye.
And bye-bye. Yeah, thank you.